Hi, I'm Ray from New Wave Home Care here in Pasadena. If VA in-home and respite care programs feel complicated, that's a very common experience. These benefits exist to help veterans live safely and comfortably at home, while also supporting the family members who care for them. But understanding how they work and how to begin isn't always simple. So let's break it down. VA in-home care is designed for veterans who need help with daily activities such as bathing, dressing, preparing meals, mobility support, or simply having someone nearby to ensure safety at home. Depending on your eligibility and the availability in your region, the VA can partner with community care providers to deliver this support directly in-home. The goal is straightforward: to help veterans maintain independence and stay in the place that feels familiar and comforting. VA respite care is equally important, especially for families providing care day in and day out. Respite allows a family caregiver, often a spouse or an adult child, to take a break while knowing their loved one is still receiving safe, quality care. It might be a few hours, a day, or several days, depending on the situation. Many caregivers assume they need to push through on their own, but respite is not a sign of weakness. It's what allows caregivers to stay strong, patient, and healthy enough to continue providing loving support that veterans deserves. Here's the big question: how do you start the process? The first step is to contact your VA primary care provider or your local VA clinic. These are the teams that determine clinical eligibility and submit referrals for in-home or respite services. From there, a VA social worker or care coordinator will typically reach out to learn more about daily needs, home safety, and the level of support required. This part is where many families struggle. Different case managers, different offices, different interpretations of the rules. So it's easy to feel like you're getting lost in the system. If you felt that frustration, you're not imagining it. Many veterans tell us the process feels confusing, slow, and inconsistent. To make this step easier, it helps to prepare a simple list ahead of time. What daily activities are becoming difficult, any safety concerns at home, how much support the family caregiver provides, any signs of burnout or exhaustion. This information gives your VA care team a clearer picture of your real needs, not just what shows up in a chart. Another important tip is to specifically ask about home and community-based services. That's the category where in-home care and respite programs are located. Using the right terminology can help ensure you're directed to the correct part of the VA system. And finally, be patient with yourself and with the process. These programs can take time to put in place, but once they are approved, they can truly transform daily life for both veterans and the families supporting them. Here at New Wave Home Care, our role is to walk alongside you. We can help you understand what questions to ask, what care might look like at home, and how different benefits can work together to support your loved one. If you have any questions about VA in-home care, VA respite care, or how to begin the process, reach out to us anytime. You deserve a path forward that feels clear, compassionate, and manageable.